The motto of North by Northeast is not just so much of having the medical clinic inside the four walls, but taking it out into the community.
When I think about community health, I think about advocating for individuals and taking a holistic approach to individual care.
They're not known by a number, but they're known by their name. We have patients that come in just stopping by saying hello because they feel welcome, they feel like a family.
They say, okay, you care about me, so I know therefore you'll care about my health. I think face-to-face relationships with our patients is crucial. You can actually see their tone when you ask them, did you take your blood pressure medication today? Yeah, blood pressure can definitely seem like a small thing. I think for most people, it's just these two random numbers that you get whenever you go into the doctor's office and they say something, and sometimes it's good and sometimes it's bad. But blood pressure actually has huge effects on someone's health. Majority of them have blood pressure monitors at home, and they can take their blood pressure at home. However, a lot of patients may not do that. Some patients, they just forget. Some patients still feel a little bit uncomfortable with taking the blood pressure themselves, or depending on the number they may see, they just don't know the next steps. When the patients come in, their blood pressure tends to do better. They're at goal more.
It was hard recovering from COVID. We weren't able to provide that touch to our patients. They weren't able to stop by and get their blood pressure checked anytime they needed to, or we weren't able to do that outreach to them.
Sharetta reached out to me and had an interest in starting a blood pressure group.
It was really easy to work with Danielle because she knew exactly what our principles were about the clinic and then also the clinical principles.
We decided that we'll take 2 months to start. We'll get a group of patients off of our roster whose blood pressure was not controlled at their last visit. Halfway into the program, we hosted a class. We gave them a lot of education on healthy food choices. We discussed blood pressure medications, effects that blood pressure has on African Americans and how race plays a different role.
Danielle's been an inspiration here at the clinic.
I originally started here as a volunteer and I really enjoyed it. So once I got done volunteering, came back and wanted to work long-term, I started out as front desk, which was amazing. It kind of really allowed me to build rapport and relationships with a lot of patients, some of them who are still here today.
And then now she's the RN clinic manager here at the clinic.
Coming full circle again, years and years later as a nurse clinic manager has just allowed me to participate in patients' care at a level that I really, really value. I love educating patients. I love working with patients.
Danielle's been a part of our neighborhood from get-go. So here she's in the community and she's gone away to school and then she's brought back what she's learned. And a lot of times we don't do that. We learn it and then we leave. And so the community never sees that. And so here, Danielle bringing it back here and then bringing it really back home to North by Northeast, to me, it makes me want to cry.
To return back to North by Northeast and to service my community now as a Black woman means everything to me. I see these patients and they are my mom, they're my grandma, they're my sister, they're me. And so I think that working with them every day gives me a sense of pride, it gives me a sense of hope. It is the most fulfilling work that I could be doing.